Good morning, everyone.
Good morning.
Good morning.
Good morning. I'm going to have to leave at 10. I have a mandatory staff meeting at 10, so just want to let you know.
Okay, no problem. Good morning, everyone. We're going to get started in just a minute after a few more people trickle in. Okay, we can go ahead and get started just with some announcements. So everyone knows this call is being recorded and will be posted to the council's website as soon as it's ready. My name is Annika Lefebvre. I'm the Resilience Program Coordinator with the Maryland Department of Emergency Management, and this is the monthly Distribution and Access Committee meeting. So today we don't have LaMonica with us. She had a conflict, but Lisa Lackenmeyer, the co-chair of the committee, is here. We're just going to go over some very brief updates for SNAP and WIC, or if there are any for WIC. And then we will be talking about something that the full council will be discussing at the next meeting in December regarding workflow for this year and what the work plan should look like. We really wanted to take some time to focus on the food insecurity map. And we have Aisha Holmes, who is also working on a food system mapping project with No Kid Hungry, who is going to share about her project as well. Okay, so Lisa, would you like to say a quick welcome?
Yeah, I just wanted to thank you and Piper for everything, and just thank everybody for joining. I know it's a really busy time and there's a lot going on, and so I just appreciate everybody's time. And there's a really packed agenda today. You guys created a really busy agenda, so thanks everybody for your time on all of these important items. So thank you, and I'll pass it back to you.
Thank you. And yes, apologies if we don't get to everything in our very packed agenda. And I think for the sake of time, this month we'll skip the roll call, but if you could put your name and affiliation in the chat, that would be very helpful for everyone to know who's here. So the next meeting for both committees is going to be on December 18th. Environment and Production is not meeting today because of the Rural Maryland Council Summit, just so everyone knows. The full council meeting is going to be December 11th from 10 a.m. to 12 p.m. And for council members, it's a hybrid meeting, and you can join us in person if you are available. Any questions about upcoming meeting schedule? Okay. With regard to SNAP and WIC benefits, we were originally hoping to have, I think, LaMonica provide some updates from FRAC on the current SNAP and WIC status. I can share on our end. MDEM spent a lot of time tracking all of the different potential consequences and current status of the SNAP lapse and the shutdown. And hopefully all of you were able to attend our briefing that we had on October 31st, right before the lapse in SNAP funding. And I hope you all know that the full SNAP benefits have now been restored as of this past Tuesday. The whole community integration team at MDEM has been coordinating with United Way of Central Maryland to launch a volunteer and in-kind donation coordination platform. So connecting needs with individuals and organizations that can fulfill those needs. So volunteer time or donating food or other resources, that kind of thing. And so we heard from Whole Community Integration this week that United Way plans to keep that platform live until the end of the calendar year, just because it seems like that need for coordination is ongoing. Any questions about that? The FSRC also launched a temporary website with updates, everything you needed to know for the SNAP lapse and shutdown. And that website is going to be live through the end of the day tomorrow. And we will be taking it down, but hopefully revamping it with some of these resources with less of a focus on SNAP and the shutdown. Any questions on that or any other updates on SNAP from attendees who may know more than me?
I can put in the chat, there are 2 additional resources. Extension has a web page that we can put that has kind of resources, both kind of pantries across the state, but also nutrition ed resources, some gardening resources related to food, some updates just in regard to SNAP being restored as of November 18th, and some of those links. So I'll put that website in the chat. In addition, I'll put the DHS website that is in regards to all the impacts of HR 1 to the state of Maryland, including to SNAP. And that has all of the most recent updates in regards to kind of the what's occurring in regards to the impacts on SNAP. And so those are both 2 resources I'll put in the chat.
Thank you, Lisa. That would be amazing. Okay, so I guess we're going to jump right into our first topic for the agenda. Something that the council's leadership group has discussed and we would like to now bring to the committees is a proposal to pause recommendations for the coming calendar year and really focus on advancing past recommendations and taking stock of all of the hard work that you have done. We really feel like the MDEM feels like there has been an unprecedented level of participation in developing the recommendations this past year, and the council made an incredible report. And it seems like there's a lot of work that can happen to advance those recommendations as well as recommendations in previous reports. And so what we are hoping to do is discuss this with you today and see if there are any questions, concerns, or ideas for this proposal. And so it is not official in any way, and a decision has not been made until the December 11th full council meeting. Okay, so here I put together a disorganized list of recommendations that we could pinpoint that have had progress made. The food insecurity map, which we're going to talk about later, is one of them. The local food council coordinator in this past recommendation. We have our Emerson fellow, Piper, here with us, who has the capacity to fulfill this role to some extent. And so we're just this full list as recommendations that have had either that have been fully implemented, like put the FSRC under the Maryland Office of Resilience and fund those entities, create a online database for local Maryland agriculture, which we know exists with Maryland's Best. So this is just an example, and I think that there are probably more opportunities for council members and partners to put some of these recommendations to into action. So I guess I'm curious to hear from you all. What would this mean for you? What for distribution and access? What are your questions about this? Do people feel good about this suggestion, or would that be concerning in any way to not write recommendations for 2026? Let's hear from you. Diana, go ahead.
I like that recommendation. I think it's very important that we focus on what we've already done to see if we can get it to move forward. So I really like that, instead of just continuing to make more and more recommendations that's not going anywhere.
Anne, did you have a question or an idea?
No, I accidentally hit the raise hand instead of the thumbs up, but I agree with Diana.
Thank you. Lisa?
I really like this idea too. And then I think also how to focus efforts in who needs to know about these and how they can think through not just knowing about them, but acting on them or educating them on being our advocates. And so I think that goes from, I think often we're concerned, at least I am as a state employee, about advocacy, but how this is really creating others like food councils or members of communities or schools, that they become advocates or knowledgeable about these topics. So they're becoming the advocates and they're talking to, delegates and stuff. And so I think it's kind of shifting, that some of these things, it's getting the information out to people that these are important issues and how to raise those. And so it's looking at each of those and kind of who are people that might who these impact and do they clearly know it impacts them, but how can they become advocates of this or knowledgeable to the right people? And so it's not just us talking to people, but it's actually the community members and the stakeholders that are actually talking about it. And so I think that it's a shift. It's taking these ideas and thinking through how to leverage them and raise them up in a different way.
Lisa, this is Stephanie Lansing. I'm sorry, I'm traveling, so I can't use my, I couldn't find the raise hand. I completely agree with you. And I'm on my way right now to the Rural Summit to give a presentation on these recommendations. And then we have another one next week at the, an agricultural meeting as well. And I think that's exactly what we need to do, is look down at these recommendations. For example, there's some that, the pop-up markets, for example. And so, can we approach county governments and say, is this something we can do county by county? Is this something where we need a larger working group to kind of make plans around? There might be a few recommendations where we continue the work groups that we use to write the recommendations and use those work groups to, contact, as you said, not to advocate, but to say, what are some things that your agency or that your county government or that your food council can do to help make some of these go into action. So I think that's exactly the idea of not only letting people know more about the recommendations and getting them out there, but creating work groups to kind of have strategies for what are things that we can do with or without legislation to move some of these forward with our own resources.
Shannon, go ahead.
I'm gonna let Teresa go because I know
Oh.
that she's first, and then I'll go.
Sorry.
Thank you. I agree completely. I put that in the chat that it makes so much sense. The Maryland Rural Transformation grant proposal was submitted at the end of September, and I will put the link to the website and you can look at what was submitted. But on an exciting note, there are 3 initiatives, and one is Empower Rural Marylanders to Eat for Health. So there will be a focus on health if we're awarded. This is $50 billion that is up $1 billion maximum for each state, and the decisions will be made at the end of December. But Maryland's initiatives include transforming the rural health workforce, promoting sustainable access and innovative care, and empowering rural Marylanders to eat for health. So it includes a lot of the initiatives that we are talking about. So I think, working on those, if we look at that proposal, there's a 1-page summary sheet at that link that I put in. So I think that we have a lot of really good recommendations. Thank you.
Thanks, Teresa.
I was just going to
Amen.
follow. Yeah, sorry. I was going to jump in and just share. So I have a question and I wanted to follow up on exactly what Lisa was saying. So one of the things that I think that state agencies have the ability to do is to convene statewide stakeholders, because we have that facilitation ability. And so with that in mind, to promote the work that each of these sub-councils has achieved or has strategized to implement, is there a potential plan for calendar year 26 to provide a convening of these entities to share amongst and really workshop those pieces, exactly what Stephanie was iterating, that you can talk about what you've done and how you can facilitate implementation of those in your region or your political jurisdiction, because it is a bottom up, top down implementation strategy. And so developing that list of stakeholders, like understanding who those councils are, because I know some have been have been established, and then who are those other partners that are doing the actual groundwork, I think would be really important. As I'm not trying to regulate them, as again, my role is unique in that I'm a regulator, and so I don't want anyone on this call to think that I'm trying to regulate you when I'm having these conversations. It's more like I would love to provide more education and support on understanding date labeling, so that we can get more donations. And so people don't feel like it's wasted food, it's surplus food, it's excess foods, it's, material, like food to be eaten, not I have a expiration date and so I gotta chuck it. So those are kind of the things that I've been really trying to understand. How do I get to the people to understand it the best? And I don't really want to throw a 5-second social media blurb out there when it really needs to get to trickle out to all of these different people. And I think that those groundswells and those convenings would be really helpful and useful for state. Now, I have the food summit that I have to put on for the solid waste infrastructure for recycling. And we have been really trying to figure out what is the best information that could be shared at the food summit for 2026. And if this could be a portion of that, I would love feedback on that and who those stakeholders would be and how we can get them to convene together and what kind of space would be best to utilize that type of convening. Is it in a large conference room? No, we don't have the date yet because we were told we might get an extension on this, and we're still waiting to see if we can get the extension from the EPA on the timing. We had actually had one, and then we heard we might get an extension. But is it the schools? Is it the cafeteria staff? Is it food and nutrition? Is it the food councils? Is it who? I'd love to know that list. So Lisa, great, supportive in everything you said. Same thing, Stephanie, and just wanted to share that insight.
Thank you. And so I'm curious, for this committee in particular, knowing that it hasn't been adopted yet by the council, do you have any ideas for where you'd like to go with the December 18th meeting? Are there any recommendations that we could prioritize for discussion? I know that the food insecurity map that we happen to be talking about today definitely falls into this proposal. What else?
I think the food council actually falls into that too. And I just want to mention that I think our focus should be exactly what you said about just working towards the recommendation, but we cannot forget, and I've seen it a lot recently, the inequity that's still in the food system, even on a state level with the emergency that we just had. We have to continue to focus on that.
Thanks, Diana. Does it make sense to, go ahead, Joe.
I want to second what Diana just said, and I just joined, so I feel like I might have missed out on the previous conversation. But on the work plan, we heard a presentation at the Health Equity Commission. We didn't hear it, but we saw the PowerPoint, and the Department of Health is looking for a substantial food as medicine initiative through their health initiatives, and they have funds, a public health improvement fund, that they are talking about something relatively large on the order of $25 million. And our sort of viewpoint is that from a health equity perspective, the food as medicine initiatives are one of the stronger tools out there. And I would love this committee to be closely tied into the health department's initiative and their planning for that. I saw some thumbs going up, but I hope that would be an opportunity that we might consider putting on our work plan together.
Joe, are you talking about the rural health transformation program that Teresa mentioned, I think, before you got on the call, but she put a link in the chat, or is this a different thing?
It's a separate pot. It's the acronyms are spinning in my head, but it's called the AHEAD program, and it was all relatively fuzzy in my head, and I think it's starting to get crystallized. And one of the things that they presented, one of the assistant secretaries at Health presented, was a food as medicine initiative using a public health improvement fund at the scale of $25 million next year, with two pieces. One piece would be medically tailored meals, and the other piece would be produce prescriptions. As a food bank, I'm more focused on less on the prepared meals and more on the produce prescriptions. And they have their approach that they are thinking about, that I'd like to engage with, is working with the enough child poverty initiatives, geography-based child poverty initiatives around the state, and directing money through to those communities, and clearly with an emphasis on kids. So there's, right, between the two components there, I think potentially there's a lot of food insecurity issues that can be addressed, a lot of, as well as the opportunity to maybe generate some health systems costs and health improvements in equity. So that was my pitch for why it should be on our work plan too.
Thank you. Thank you, Joe. Anything else? And thank you for sharing all those resources in the chat, Teresa and Allie. Okay, well, we can definitely circle back to this conversation later on, and we will see what happens, of course, in the December 11th full council meeting too. And I'm going to send an email out to the full council to keep this conversation alive until then. Now we're going to talk about the food insecurity map. If you haven't had a chance to take a look at it, I would love if you could pull it up now. We are very lucky in that DoIT, the Department of Information Technology, partnered with Distribution and Access this past spring to create an initial version of the map that the council has been mandated to create. And they have now shared maintenance abilities with MDEM, and we have Shane Weiderman, who's a risk analyst from MDEM, here with us, who has been assigned to help carry out any requests that we have to improve the map. And so I would love for you all to take a look at it now. I put the link in the chat to the FSRC webpage, and it's linked there under, it says new Maryland Food and Security Map. And I would really like to talk with Shane about what would be helpful to improve this map. I also want to, we're going to hear from Aisha as well about her mapping effort and ways that we can integrate what she's doing with this food and security map. So here's a list of the map features that are there right now. That's also on the website. We have the Maryland Census Tract, healthy food priority areas, areas with high rates of food insecurity, areas with high rates of SNAP enrollment, WIC benefits, Medicare and Medicaid eligibility, food banks and pantries, TFAP organizations, SNAP retailers, Maryland market money vendors, farmers markets, public school districts with 80% or more eligible for free or reduced price meals, CLFF producers and processors, cold storage infrastructure, and Medicaid and Medicare healthcare facilities. And so I know that Meg Kimmel worked very closely with DoIT on this map, and I missed the creation process for it. But the things that stood out to me as next steps I'd like to see would include changing the wording of food desert to healthy food priority area to align with the council's preference for that term. I think that descriptors of each indicator are needed. I think it's hard to navigate for someone who's not super experienced with ArcGIS, and it would be helpful to be able to see like more information about the sources that are informing the different indicators, what date ranges they capture. Like we want to know if something is really outdated in this map. And also are a few indicators that seem kind of vague. Like I don't know what WIC benefits means exactly. Shannon.
Yeah, I actually am noticing that cold warehouses and food pantries are exactly the same icon or symbology. It's the same symbology.
Shane, I'm going to put you in the hot seat and have you introduce yourself, and we're hoping that you can chime in with and tell us what is and isn't possible to update too.
Yeah, absolutely. Thank you, Annika. So my colleague Sarah did an initial review of a lot of this and captured some of those issues that there are duplicate symbologies and things like that. And that is all absolutely stuff that we can change for the final mapping product and kind of deconflict some of that and make it a little bit more accessible. The items that you brought up as well, we could definitely include some additional clarification there and better describe like the data vintages and what areas we're actually looking at and showing how up to date the data is, and also additional information descriptors. All of that's possible. So yeah, so far I'm not seeing any issues. I will say, so I got an email from Demetrius, the contact at DoIT that we had who was working on the map, and he provided us. So I think currently the FSRC web page links to that map in web viewer, and it's not the instant app, which I just put in the comments, which is a little bit more cleaned up because kind of the map viewer is kind of like the working version. For us, that's kind of like, you know, if it's still like a work in progress, that'll be kind of like what we're doing more of, turning on layers and still sourcing data and that kind of thing. So the instant app will be helpful a little bit in cleaning it up a little bit more. I mean, there's still work to be done there, but that's at least a little bit closer to prime time as like a presentation view.
Thanks, Shane. I think you need login capability for that link. I could be mistaken.
Gotcha.
So this is the version that Demetrius shared with us that's like public ready.
Oh, okay. Well, that's, yeah, we can look at how that's set up.
We would love a more user-friendly format.
Sure. No, definitely understand that.
What else? Shane, on your end in the maintenance, can you see like the dates of the sources that are informing the indicators?
Yes. So we'll be able to like basically, so each of those data sets, we can go in and look at the actual like item listing in AGOL and ArcGIS online, and that'll tell us, you know, what the latest data vintage is and what years those data sets are from.
Great. Lisa?
I'm just curious, and this could be my understanding of it, is the goal when you go over a data, like one of the dots, for it to actually identify what that is, or like like I just typed in like my address and then seeing all the dots around it, like none of them are identifiable of what they are. And there's like way more dots than there actually are retailers or or anything around me. So I'm curious what they are, you know, but it doesn't actually indicate.
Yeah, when our team was messing around with it, we noticed that you have to scroll, like zoom way in to see the actual information when you hover over specific icons. And
Yeah,
Shane,
Lisa, Anna and I were working with it. You have to like on the top corner, you have to click that little like left over and it'll tell you the name of the store. Like you have to do some things to get it. It just shows you the census chart first. And then if you click on that little over left, then you see the name of the store. So it is quite confusing in this view.
Oh, okay.
Shane, can you show us the more user-friendly one that you put in the chat?
Sure, one moment. All right. Whoop. All right, so this will at least clear up some of the additional map viewer options that kind of, you know, I think distract from a lot of the stuff. But still, yeah, this will definitely be like an ongoing conversation, but we can figure out what are the priority items to label, like when you're first looking at it, and then also set up pop-ups. So basically, if you click on something, what does or doesn't come up, and how to better format this than just dumping all the attributes for every data layer that's underneath onto you there. Because yeah, this the way it's currently set up right now is really just putting a bunch of data on a map, and it's not really accessible for kind of a broad audience that isn't already, you know, planning to go in there and turn off and turn on the things that they need.
And my understanding, Shane, is that some of the, or at least some of the data sets that are informing this map are updated regularly, like the Capital Area Food Bank organizations that they work with. I know Demetrius said that those will be updated by the Capital Area Food Bank, and then that will be reflected in this map. In general, like, are the other data sets in here something that will have like a self-maintaining feature, or is this something that we're going to have to revisit periodically?
It's probably going to have to be revisited to some degree, depending on how organizations upload their data. Because a lot of times we'll have to switch it over to a more up-to-date version. If it is like kind of a live data set where they are still using the same data layer, and they'll just change, you know, every month or so what you know, stores they have in their inventory, or what you know, retailers they have in a certain directory, and then that'll be live updating. But yeah, there may be somewhere we just have to point it to a new or more updated data layer, which isn't that like just to say, depending on your familiarity with it, that's not like a complicated process, but it is something that we will have to go in and touch, and it just won't happen automatically.
I think that something that is probably relevant to discuss is who the audience is for this map. So in the council's reports, the primary audience has been like food system advocates, technical service providers, and government officials and legislators for decision making, and less for members of the public to find like food access opportunities. What are there any audiences that we should be keeping in mind to set this map up better? Shannon?
Actually, I was gonna go back to, you were asking what else do you think would be useful or helpful. I feel like sometimes the radial approach is really helpful to understanding how far it is from services that from these like how far are the services from the areas in which need that additional support. Sometimes it's not as easy to understand the distance that these resources are from the need, right? So I feel like having that radial input to, let's say, either cold storage or whatnot is useful and helpful, because then it allows you to really see that additional information. And I think that like legislators are not going to add radiuses to these. And I think that that's a tool that they would find useful. And then what I meant by the API is that it would be a direct refresh. Shane, are there any APIs built into this so that we can connect databases accordingly?
That I'm not so sure of. So basically all of this should be, I haven't looked at where all these data sets are coming from. I imagine most of them are currently updated to Esri's ArcGIS Online, and then they're just pulling them in from there.
Shane, would it be helpful if the Distribution and Access Committee like put together a list of requests, or what would be a good next step for us to support you in helping us update this?
Yeah, I think a list of requests would be great. I think we have, a handful of things that we already know off the top should change. I also think just in general, structuring and grouping the data layers into the categories you've shared would be a good start, just for basic accessibility and, making it more navigable. So we have some starting points there, but in general, if people just want to brainstorm on it and think about what overall might want to add or change, I think that would definitely be helpful.
Great, thank you. And does anyone on the call have the desire or ability to join a very temporary effort to make that list for Shane and his team? Any map enthusiasts who want to support that? Thanks, Diana.
And I will also say it also could be a very high level, just kind of general subjects if there's additional data or whatever, because our job is going out and looking for that data, and we can find out what we have available or what we might need to dig a little deeper for, or work with partners. But yeah, so even if it's just a very high level thing, you don't have to run all the data down yourself and give it to us. We can do that end.
Okay, thank you. That's helpful. Okay, so next on our agenda is still a continuation of this conversation, but turning it over to Aisha to talk about her mapping effort. Aisha, are you here and ready to share with us?
I am. Good morning. How is everyone? So I will start by saying I am incredibly impressed to see things that I've just seen in the map. I'm going to give a little bit of background about the project that we are working on the Eastern Shore. and then I'll share my screen in just a minute. And there's several partners on the call. If you all want to jump in from your perspective, feel free. About 9 months ago, there was a convening on the Eastern Shore, folks might remember, that brought together somebody from each of the counties to kind of think about food security. We talked about food policy councils and a good variety of things. From that conversation, each section of the shore, upper, lower, and mid, committed to kind of digging in on the idea of food councils, and happily, there are food councils in each of those regions. And so part of the conversation that came out, especially around the midshore, was really thinking about how to have a map or a resource that would really provide us with a clear understanding of that midshore region around what food assets we had in the community. And so we started thinking about that. And from that conversation, it became apparent that other counties within the Eastern Shore were also interested. And so this has kind of morphed a bit into a full shore project versus just a mid-shore project. So we're happy to have organizations involved throughout the Eastern Shore. And it's really been very organic. If folks want to be involved, you're welcome to be involved. We will take your brain power. But really the idea was to put on the map the resources that we can access, and also resources that a community member could access. Really thinking a little bit deeper around breaking things down. There's the food banks, but then there's food pantries. There's some food pantries are in schools, some food pantries are in communities. So kind of breaking down to a little bit more of a micro level. And then from the asset mapping, the reason we're involved is really for us to also be thinking through, once we know what's available, where and what are the gaps, and then we can start planning on how to fill those gaps. So that was the thinking behind this project. And this does not happen without a lot of kind of on the ground community input. So some of what we were just talking about related to people looking at information and entering information and verifying information, that is necessary in order to build and also ultimately to maintain such a resource. So I'm going to quickly share my screen and kind of walk you through where we started. Now hang on. This is the hard part. And I apologize. I have a cold. Are you able to see my screen? Okay.
Yes, we see it.
All right, great. Thank you. So these were these 20 ish items were the things that the work group brainstormed and came up with.
Aisha, could you zoom in a little bit? It's just small in the Google Meet screen.
We can. Let's see if this will help. If anyone can tell me how to do it, I'd be really grateful. Because
if you go to the top right, those 3 dots in your screen, your browser.
These?
Yep, that. Yeah, there's a zoom feature there.
Oh, wow. You're brilliant. Seriously, had no idea this existed.
Oh no, she can
that
just go up
better?
to the top left. No, go up to the sorry, go up to the top left. This I go through this all the time, Aisha, if that helps you. If you go up a little bit higher in the screen, like from your document itself, just scroll upwards.
Going slowly.
If you go on the right hand side, you'll see that gray bar. If you go all the way to the top there, and then instead of having it at like a certain percentage, you say to fit to screen, and that will expand the whole way.
Not seeing any of that, but let me go back to the Zoom and how's that? Did that work? I think it's bigger.
Yes, that's great.
Okay, great. Okay. Sorry, tech is not my thing. So the idea was really just through a brainstorming process, we came up with these 20 things. It's not exhaustive, but it's a place for us to get started, and something that folks in our communities that we're partnering with felt like they were able to kind of pull together. So as we've kind of begun this process, and I'm noticing as I'm looking at this, and I think not surprisingly, that the map that was just presented by Shane similar, like a lot of what we're looking for on this map is also similar to what is already presented on the other map. So we are very much in the infancy process of this, really pulling all of this information together with the hope of having it on a map by January. So I'm going to just switch over to a different, okay, here we go again.
If you want to make it bigger, do you see where it says 100% on the left-hand side by like the printer icon? It's right underneath. Yeah, if you make that bigger, that actually makes your screen bigger for everyone to see.
Oh, okay. All right. So as you can see, we kind of have broken it up on those categories at the bottom here, right? So really thinking it from the schools and the community gardens versus the pantries, backpack programs. And we broke it out by county. And in the school tab, for example, obviously we're going to look at public schools, right? And so in addition to just knowing that there's a school, we also wanted to know whether or not the schools were fully equipped, meaning that they had working equipment, cooking equipment, refrigeration equipment, those types of things. Were they MMFA, serving breakfast in the classroom or breakfast after the bell? And were they CEP? So really thinking through, like, not only the resources of the school, but within the school, each school, what is the kind of next layer of resources. So we are doing the same thing through for backpack programs, for example, thinking through where they are, what they do, and then verifying them by making sure that they are actually there. So that might be the person who works there is verifying them, someone who has had contact with them, that kind of thing. But the verification part is super important because without that, we are not 100% sure that it exists. What somebody wrote something, and I'm wondering if
I'm just chiming in on what you're saying, that including the backpack program seems like a helpful thing in mobile markets and pantries.
Yeah. Sure. I mean, we can share this out also, but yes, from a statewide perspective, I think that those things make sense because they are part of the food security that we're trying to reach. And I think all these pieces kind of brick up together to make it happen. So there's a variety of things that we are collecting, and what we are doing next month is really shifting from the collection into the map making. And I'm going to stop sharing my screen. Sorry. Okay. Shifting from the collection of the information into the map making, and hopefully having that information kind of on a visible map so that we can start refining things as we go. And yeah, we know that stuff is definitely going to change. And so we're going to be trying to figure out how to have some of those changes be able to connect on the back end. And definitely we'll connect with you about that, as well as Joe. But really thinking through at this point how to create a product that is available for the communities in a way that is accurate, probably the most important thing, and easily accessible. So the idea was initially what we talked about was that we would host it on our No Kid Hungry Maryland website, but that none of this is written in stone, and that it would just be available to folks, and we would do the best we could to try to keep it updated using the information that we've collected and then asking for verification along the way. But I had a conversation with Annika, and she suggested I come and share what we're doing with you, because now there's 2 mapping projects at least. There's probably more out there. And just to hear your information and to think about whether or not it makes sense to expand this a little bit, look broader into the state, look deeper into the region, but just wanted to bring this to you as a resource or an opportunity, depending on what folks are thinking. So with that, I am excited to hear feedback.
Lisa, go ahead.
I think this goes to your question before, Annika, in regards to the attended, the audience. This seems very much, focused also to the user or to the participant or, to a family in the community. And so I'm unsure how to blend them, or if there's that possibility. The one we saw earlier, I feel is extremely complicated for a community member to navigate. It also seems to have 2 separate kind of a lot of resources to, update and when a lot of it's potentially the same information. So I think that's, kind of this potentially that group that you're convening in regards to mapping. Is there a way to have something that's both user friendly and, easy to navigate, that meets both needs? Because updating is obviously going to always be the challenge, is keeping something updated. And so, but also there's definitely 2 intended audiences, and making something that's able to be beneficial for participants is a really different interface. And and so it might need to be 2, but then so I'm not sure, it just seems like having 2 being updated all the time feels like a lot of long-term effort and resources.
Lisa, I agree.
Diana, go ahead.
I agree with you, Lisa. And I'm just wondering, are we having too many maps? Because we have a map at Maryland Food Bank. We have a map at some of the other food banks. So do we have too much of this going on? And because it is it's hard to upkeep a resource manual. I know we've gone beyond resource manual, but it's kind of the same thing. How do we keep it up to date?
Can I ask a question relative to like the intention of the audience for the outreach? Is there a way, like there's so much valuable resources here, but doesn't seem to be a way that says like, hey, Caroline County Beth did an amazing job doing this type of activity with her backpacking program. How could county in Garrett County execute a similar program? And what are those kind of like similar execution programs? Like that, I think that might be the resource that is really useful to like the food nutrition folks and the ones trying to assist the community itself is like, I witnessed this program implemented here. Here's all the facts on it. This is how much it costs them. This is how much staffing they require to do it. And this is, you know, the resources. And this is how you could replicate something in your community. If I'm mistaking, you know, the benefit of the map versus the resource.
I think I missed a piece in the middle of what you were saying, Shannon. And your voice kind of went out on my computer. Can you just go through that again, just so, because I missed like the important part.
Yeah, so there are so many valuable resources and work that you're performing. Like on No Kid Hungry, there's so many benefits to the work you've been doing. And I think that you have provided funding and resources and support to doing the execution of these programs. And so the work that has been performed in supporting of these benefits and resources, it's such a to get a statewide updated document like this or a resource that's like this for a map might be really difficult to maintain. Whereas, you know, in a local level and the ones have the touch point on it, right? So Beth can say like, hey, our mobile market moved over to here. It's not, that resource isn't there. And so is it better to have more like information on how to create this locally than as a statewide led map? I guess is my question. Is there a benefit to a state mapping on this versus a resource page that provides you the ability to recreate some of the activities?
Oh, I like that. Now I understand. Thank you. Yeah, I think there's both. So the reason we started more locally really was because we wanted the nitty gritty. And that is much harder to do and maintain at a state level because you need partners on the ground who are committed to helping to maintain it. That's really the key. And so I would definitely agree with you in that sense where something more locally driven has a better chance of staying current longer. And part of how we set this up was to ask each county that's engaged to provide 1 or 2 people to a work group so that we have kind of point people to work with to get this done. And so for example, Beth's on our work group. Beth, I'm going to pick on you. Beth's responsible for getting the details for Caroline County. Now, Beth knows a ton of Caroline County stuff herself, which is great, but there is a wealth of information that she may not know. So she goes back behind the meeting and then checks out with her partners and makes sure that what's there is verified. And that's what we're asking from a partner perspective in order to build something that is micro enough to be helpful to the community, macro enough to be helpful for the region. And the idea is, you know, is there at the end of the day, where my thinking was, is there a way to leverage these resources across a geographical region at the end of the day? So like, where are the gaps and how to fill them without necessarily every time recreating the wheel? So from that kind of higher level perspective, I totally agree with you, Shannon. I mean, this is a way to bring those pieces together and help us understand what's in each region. And if we do it statewide, I do think you start to water some of this down unless everybody in every county commits to doing some of this. And yes, 211 is an incredible resource. And through the pandemic, they were really a go-to resource. And I think I have nothing but good things to say about them.
Well, thank you, everyone. For the sake of time, I think we're going to have to put a pause in this conversation, but I think that everyone's really excited about this effort. And thank you, Aisha, for sharing your project. And we hope that we can hear updates along the way and find a way to collaborate and make it like beneficial, mutually beneficial and not duplicative. So thank you for that update.
Pleasure.
Any final thoughts before we end this call? Okay, I am going to Teresa, go ahead.
Hi, I had just wanted to introduce, I don't know if he's still on the call, but Nick Klein, he's the Vice President for Advancement for Horizon Goodwill, and they are putting a grocery store in a healthy food priority area in Hagerstown. And I recently reached out to him to get an update for the meeting for today, because I see we have the healthy food retail discussion that we didn't get to. But I just wanted to let you know that he did come to the meeting, and they are working on the grocery store. They're hoping to open it in the first quarter of 2026. So it's a very exciting project in Washington County. Nick, are you on?
I sure am, and it was a pleasure to join you all. You guys are doing amazing work, and so thank you so much for the invitation. And I'll continue to come and mostly be in the background, but look forward to providing updates as the project nears its completion. Thank you.
Thank you. And sorry we didn't get to that part of the agenda today.
No worries at all.
Thank you, Nick.
Okay, everyone. Thank you so much. And Teresa, thank you for chiming in with that. If anyone wants to continue the conversation on mapping and what would be most helpful for the FSRC's mandated map, please send an email to me with this FSRC email address that you see on the screen. We want your input and are grateful for your contribution. So thank you. And yes, thank you, Beth. Happy Thanksgiving to everyone.
Yes. Happy Thanksgiving. Thank you.
Bye, everybody. Thanks.
Bye, everyone.
Bye.
Bye.